doctors should get this training? Why should a resident choose this track?
Well, I think that, I think that whether or not you, wherever you practice and whatever setting you practice, you're going to see a substantial population of LGBTQ plus patients and a substantial population of transgender patients. That, I think a lot of the things that you learn in primary care apply to everyone, but I think that having a little bit extra training, especially at this specialty clinic, I think it's really invaluable for being able to take care of kind of a broad community in the future and really take care of the community well. And I think selfishly part of the reason too is like it makes you very marketable, and people will be interested in bringing you into their practice in the future if you have these skills.
I would say why you should do it is because it's our job. So our job in family medicine is to take care of everyone, and if you can't take care of everyone, then you're not doing your job. So I look at this the same way as like if a kid comes in and has a cold, I should know what to do about it. It's the same care. The other thing is, so many of these patients have multiple conditions that will tie in. So because of the stigma that they face for their entire life and a lot of the trauma, they'll have mental health issues. That's also our job. Sometimes hormones can be a little bit more tricky when they have underlying medical conditions. Those underlying medical conditions are also our job. So it's one thing to send somebody to the endocrinologist, but the endocrinologist isn't necessarily trained or equipped to have conversations with them about their depression and why it's going to get better or worse, or why we need to work on cholesterol or blood pressure. This really should just be our job. For me, one of the reasons why I love it is, so much in primary care is fighting for just a centimeter of progress. Like a patient goes from smoking 10 cigarettes a day to 8 cigarettes a day, and you're like, yeah. And sometimes that can feel like it's wearing you down a little bit, and that you're not making a huge difference. But with our patients, it's a huge difference. To help somebody go through transition, your first visit, you see them, they can be shy, no eye contact, very soft-spoken, very just fearful of you even being in the room with them, or even listening to their heart or lungs, And then they're on hormones for 6-8 months, and you go in the room and you don't even recognize them. Everything about them has changed. Their confidence, their appearance. I think it's super, every single time it happens to me, it's really, really, really rewarding.
Right. And we strive for that with all of our patients, but it's a stark difference with my trans patients compared to the average, how much change we can affect in these people and how much they change by the time that we get them on kind of the appropriate treatment for things. So it's definitely a rewarding field of medicine that makes me excited to go to work.